Hey guys, Merry Christmas to all of you, and and Happy New Year as well. So today I've got Mr. Soumitra Nanda with me, and I will just give a brief introduction about him. Sir actually, started his career in Reliance as a business planning manager. Then he had an instant at HP as a business planning manager again. Post that, he actually went ahead and joined Accenture Strategy, and predominantly handling the healthcare wing of the company, of the consulting division. And then he was a part of Cognizant. Now, Mr. Nanda is a very active angel investor. Besides, he's also a venture partner for our ventures, and plus he holds significant positions inside a number of other healthcare organizations as well. So I welcome you, sir. Thank you for taking out time, and we welcome.
Thanks, Rizikesh. The pleasure is all mine. So, just a little bit before we get deep into it. So, before Reliance, I have something which is not in my LinkedIn. It was a short stint. So, after my engineering, I had joined L&T. Then, I broke for my MBA. After MBA, as you rightly mentioned, it was Reliance followed by HP. But my major time was spent with Accenture, where I started, along with a couple of other people, the healthcare practice, consulting management consulting practice, and then built on top of it. Then I transitioned to Cognizant, and after that, I've been an angel investor and associated with several healthcare organizations. And I also have, in fact, I'm looking at two things. One is in a stealth mode. We are trying to impact the clinical decision making, which is lacking with the health providers. And then my other area of interest is public health and primary health care, where I'm actually associated with a few entities. We're trying to make a difference. It's a matter of time and it's going to happen slowly.
Superb. And then sir is married as well, and he has a small, sweet little daughter as well.
Yeah, my kid is in grade one, so obviously she is going to touch seven by end of January. And I stay with my wife and my daughter here in Bangalore.
Great, sir. Sir, before we actually jump into your professional journey and all those things, we all want to, understand it a little bit about your background. From where did you come from? Where did you get that motivation? What actually, established that building block of your life?
Okay. So typically, I come from Cuttack in Odisha. That's a town in Odisha. In fact, Bhubaneswar and Cuttack are the twin cities, as you know, in Odisha. So my background wise, my parents, my father was a bureaucrat, but he was an atomic physicist and a bureaucrat. So there was a significant focus on education. There were a set of family values like adherence to norms, discipline, not very tight, but obviously something that's commendable.
Yes.
Uh, I completed my education in my engineering and my schooling and engineering in Odisha itself. I was a campus hire with L&T ECC. Then, I went to do my MBA and then all the other things that I said happened. So, few things that have shaped up my career are obviously one is the family values, which family values your formative stages in the school itself. And then as I moved into L&T, there were a lot of learning there. L&T, as you know, I was not into L&T IT, but into L&T Engineering and Construction Division, which is now the flagship group of L&T. And there was a lot of hard work, a lot of learnings. There were a lot of places I saw within India. That was the first thing that shaped my career. And I had some impeccable bosses who helped me shape the career. Obviously, I can't forget them. Next phase was my MBA. In fact, I was a lateral, so it was a little easier for me. But having said that, MBA has got its own charm. You go through a competitive. In fact, I went through CAT only, so obviously, many of you who have written that know how intense the competition is. The B school, I did my MBA from SPJ, and so B school provided that foundation once again. You're basically the building blocks for your analytical skills, your lateral thinking, and you as a more consummate individual, not like an individual who's uh, sum of parts, but more than the sum of parts, I would say. Then followed by that, my experience with Accenture. Accenture, in fact, I not only served as a senior consulting leader, but I started with the healthcare practice. moved from India to the, on a global model we worked. I probably got to work and visit for different in different capacities several countries, including the US, UK, which comprised London and Scotland. Then I worked in Hong Kong. I had a stint in Middle East. Then I had a stint in India, and so there the story goes. So there was a lot of cross-cultural pollination of ideas, working with people across geographies, understanding how they work, in particular how healthcare works.
Yes.
And then obviously when you build all these things, you also develop a lot of people skills, because that is something which I realized can't be taught in any books or anything. So that was another part of my career which was shaped by my the leadership roles that I played. Now the shift that I made was again from healthcare to angel investing, and as a healthcare entrepreneur. So when I say healthcare, I have worked across both health insurance and the hospital or the health system side, as you say. So I'm pretty much conversant with both the facets. So that was a new experience. It took some time for me to learn. Venture capital, all of us talk about venture capital, but it's better said than done. Once you soil your hands, you learn it. That's how I learned, both as an investor and as someone who's building something on his own. And I'm also associated with, other than healthcare organizations and these investment firms, I'm also associated with a lot of other ventures which are actually enabling startups. So some of them are pro bono and some of them are on a basis like a stake and all those things. But that's also working out. You get to meet a diverse set of people. You get to work with people. You work with several individuals, and that's how the story unfolds. So if I were to summarize what has shaped my position so far, one is definitely the willpower. So if you don't have the willpower, you won't move forward. Second is the family values, the formative years, and then my what I would say, my propensity to take challenges as they come. See, there is nothing which is set. You have got a set foundation, but as you work on something, you basically uh, get stronger and stronger. So those are some of the things which have shaped my progress so far, both as an individual, both as a professional, both as a guy who has a broader purpose. Like, I want to create an impact in healthcare. As you most of you know, public services, public health, anything that's public takes time, but the kind of impact it makes goes to millions, billions, and so far, which is a big objective which I want to give back to the society as I continue to evolve in my current role.
Right, sir. Uh, so you started as a business planning manager in Reliance and in HP as well. So we want to understand that what does a planning manager do? Like what is his work like?
So, see, when I was a hire from the campus by Reliance,
Okay.
and I was a part of the petrochemicals division, which was at that time, 2006, it was $5 billion by net
Mm.
revenues. So typically, business planning, there are multiple things. People say business strategy, some people say business planning, some people say corporate strategy. Well, they have certain things which are common, certain things which are different.
Mm.
But at the end of the day, the biggest thing a business planning manager has to do is to think big,
Mm.
look at the low hanging fruits, act on that, produce results, but more importantly, connect the dots. So typically, the situation is that every day things are changing. One business which is doing well today may become chaotic tomorrow. Competition may come in unless you are doing something disruptive. Even if you're doing something disruptive, there may be a behemoth who will try to twist you. So you have to learn the way, and it's typically you connect the dots, you look at the bigger picture, but at the same time produce results by acting on a set of things which are very, very practical. It's just not about giving a blueprint or just creating a set of slides and giving some recommendations and you know putting an end there. Today, things have evolved. So that's what is one of the things which I would say a business planning, business strategy, whatever you say, even a consulting for that guy, that a guy should do.
and then the next thing is that how come this ye healthcare happened to you after being a business planning manager for around 4 to 5 years?
Well, it wasn't, you'd say 4 to 5 years, it was about 3 years. But having said that, that was another industry, healthcare is another industry, and so far. So, before my MBA days, I had worked with L&T, which where we used to do turnkey projects. And some of the projects were, towards the public health side. For example, if you see water supplies and sanitation, in some states they fall under the public health and education department. So, because of a little bit of background in my public health, when I was hired with Accenture, I was asked, can you basically do something about public health? So, I joined in the public health space, but within a year, public health and commercial health all got into one bucket in Accenture. There was a massive reorganization. And I then learned healthcare all along the strings by working on short assignments, also through a bit of program management and creation of offerings and the consulting activities. So it was a migration. It was, I would say, a little bit by chance, but the chance quickly transitioned to choice. I like the industry. I built the industry. I worked with the biggest health insurance companies in the US, doing consulting and digital projects for them. I worked with some of the largest providers outside of the US, including the US, UK for that matter. I also worked a bit on public health side, and then on my own startup and all those things. So what transitioned to health basically was a typically became the lion's share of my career.
Got it, sir. Now, so another related question is that, so if somebody from a B school or from an engineering school wants to pursue a career in consulting, what should be the way through your advices to them?
See, first thing is one thing I'm a firm believer is in raw horsepower. For example, some people are left brain, some people are right brain. Predominantly, I was a left brain teacher, but then slowly I realized that I have to be right brain to some extent. I have to be creative in some aspects. To cut the long story short, the basic tenets that are required for a person to get into management consulting or strategy is very superior analytical and thinking skills, which could be both lateral and critical thinking. See, without that, what happens? You don't grasp the big picture. You're not able to connect the dots. As things evolve, as you grow, older in the organization, as you become from an analyst, you become a consultant, you become an engagement manager to a principal to a partner and all that. Slowly, your people skills, including your manager, your subordinates, and client handling, will come into picture. But in the
Yes.
formative years, which is most majority of the crowd is, the basic thing hinges on two things: your thinking skills, lateral and critical thinking skills, and analytical skills. Those are the major attributes for a for a budding consultant, I would say.
So how should they improve upon that, sir? Like analytical thinking and critical thinking, what should a person do that he keeps on improving on that?
So one is basically things come naturally, naturally is to some people, but it can also be honed by practice. For
Yes.
example, when I was with Accenture, and anyway, it's Accenture proprietary, but uh, still, if you look at it, we used to go by certain frameworks. We start with the problem, the situation at hand, the key challenges, the questions you have to do, the analysis to you. And similarly, if you look at McKinsey for that matter, most of us know about the MISI model. So MISI is mutually exclusive but collectively exhaustive. So that kind of a thinking has to be ingrained, and it has to be ingrained not just when you go to a B school. It has to be ingrained right during your engineering days, right from your graduation days, whatever you are reading through. Let's say, for example, you read the newspaper. I'm sure many of you would be reading Economic Times.
Hmm.
So let's say an article has come. The way I look at it, not now but over the years, I just look at the heading and I don't go through the whole article. I make my own analysis based on my familiarity with the subject. If I'm not familiar, I have to know a little more. If I'm familiar with it, first I need to think about it. What would be the whole thing about? I do my own analysis, then get into the thick of the matter. That's one way. Second thing, you have to constantly get involved in reading a lot of things beyond that. See, basically, I'm into healthcare. But I can speak about oil and gas. One is because I've worked. I can
Yes.
talk about the what's happening in the financial or the stock markets for that matter.
Yes.
I can talk about a bit about what's happening in the electric vehicle. So what I'm saying is you should have depth, a breadth that will increase your understanding of several concepts, and then develop depth in a couple of areas that are your areas of choice. That's how you play by your strengths. That's how you're differentiated. But
Yes.
as I said, critical thinking and analytical skills will come from the way you look at problems and solve it, any part of the things. Whether you are, see, it doesn't matter whether you are sitting in the class, whether you are at the airport, whether you are at the client office, doesn't matter. Everything presented to you is a problem.
Right. So this means that, sir, getting into consulting, MBA degree should not be required.
Well, that's kind of a paradox, I would say. What MBA does it hones you up. And when you go to consulting, obviously you need a lot of things which are covered in the MBA curriculum. So you have a set of subjects, whether it's finance, whether it's marketing, whether it's operations, whether it's about what I would say business law, everything is needed. So that gives you basically a holistic structure. That's why I said you should be reading each and every topic as much as you can, or as much as scope you get. But getting to B school has a pre-qualification. That's why all these competitive exams are designed. For example, whether it's CAT, GMAT, whatever it is, they test you on that. Then they hone you. But having said that, what is the one trend that is coming up is people going for work for multiple years in your. You work for some time, you gain the things on the ground, then you go for an MBA. It becomes easy. And today, what is happening? People are not going that route also. People are
Yes.
doing their graduation, engineering, and all, whatever it is. Quickly working something on, let's say, data science or, what you call today as generative AI. They are
Yes.
learning, hands-on, they are learning. So it's dependent on how you want to do what you want to do and all that. And if you look at, the investment banking companies and even the MBBs, McKinsey, BCG, Bain, they pick people from IITs who are not
Yes.
MBAs for that matter. So it's a choice. But having said that, what MBA does is it basically integrates things and makes you aware of what are the business functions.
Yes. That is true,
That's
sir.
one. And the other thing is what it gives you a sense of competition among collaboration. You do group activities, you participate in a group or whatever it is, but then as an individual you have to prove yourself. Otherwise your grades will come down.
Yes.
And even when you write CAT, what is happening? Say, for example, I don't remember what is the pattern of questions today, but when I used to write CAT, there used to be like about 150 questions that got reduced to 120 or 30 questions. To
Yes.
get to even the top of the, top IMCBC, probably you needed a score of just a 50 and above. And maybe the other IIMs, you needed a score of like 40, 30, 39, 40, 42, like that, provided you qualify in all sections. But what did that mean? You're making the right choices. So B school is one which also helps you make the right choices. For example, given a set of opportunities that are there, where do I put my feet? What do I work on? So that's the additional advantage that you get, in addition to you honing your skills across the business functions.
Right. So, sir, so I was just actually thinking. So I'm just thinking aloud because I've been observant of these. A lot of people, coming out of B schools, like including me, including you,
Yeah.
because
Yeah.
both of us come from a very good B school. So but 90% of the things which are being taught inside the B school, usually take established companies as use cases, right? Like the policies, the use cases, the marketing case studies, or even the sales case studies are of established companies. So when these B school graduates now, since India has a booming startup culture, when these B school graduates come into a startups, maybe for whatever reason, like maybe for money or maybe for position or maybe to create an impact, they start applying the same kind of the tactics which they learned inside their B school, which is applicable to the established companies in the startup space as well. A lot of the things have gone wrong, and because of which people have started perceiving is that people from premier B schools, they are not good for startups. which I completely disagree. But your viewpoints on that, sir?
Well, see, it's again, as I said, there are two things. See, when we used to read, when I finished my MBA, it was 2006. So we used to read case studies from Harvard, case studies from mostly the Harvard case studies and all that, which are from established companies, both success and failure studies. So, and simultaneously, what I've seen is case studies being developed. So you don't become really great when you read a case study, analyze it. That is one part of the story. The other and significant part of the story is when you build a case study yourself. And some B schools in India, I won't name them because of multiple reasons, are active. And I say B schools, mostly the premier B schools, because that's what they can afford and people trust in them. They're actually visiting organizations, working with them to create case studies. So many individuals are involved. So when you make a case study, you are not making a case study for the whole organization. That would be akin to a corporate strategy. They're doing a part of the organization they're looking at. So which is similar to a startup, because startup is like a fledgling corporate entity, isn't it? If it becomes successful, it's a corporate at the end of the day. So that concept is changing. But at the same time, a person who goes to a startup, see, startup is something which requires, there are no hard facts. Even if you want to draw analogies between two companies, you can't draw because things are very different. And I've done this myself as I'm trying to build my own things and I'm on the advisory and on the board of several other companies. I'm trying to build this. So sometimes things may work out, sometimes there's no hard data, sometimes you have to just go by your gut. But what it develops is you basically develop a hypothesis, use whatever facts are available, which is sparse, use whatever analogies are available, which is again sparse, and most importantly, use your own power of reasoning. Then you basically validate or reject a hypothesis. But that is exactly something you are reading in B schools. You are supposed to read at the B schools and the premium B schools if things are going in the right direction. See, where was this all this Apple, this Siri and all developed? Well, you know the name why Siri is there? Because it was originated from Stanford Research Institute. That is how Siri, the name Siri came. So what were they doing? They were also toying on ideas. See, when Apple was formed, was it not a startup? It was a startup. When Amazon formed, was it not a startup? It was a startup. So what I'm saying is B school, people from B schools could be useful everywhere. But there has to be a mindset that when I'm moving from the B school, I need to first survive and thrive in chaos. So that
Absolutely.
is what I'm referring to the VUCA world. There is nothing called, I would say in today's world, entitlement.
Yes.
But when you are better prepared, you can grab an opportunity better. You can do justice to it. And therein lies the difference. But having said that, it's not necessary that someone has to be just from a B school. A person who's having a sharp, the skills that I mentioned, and with a passion for doing certain things, can go up along the way. Maybe he has to fortify his areas over a period of time, but that can be done. But to your point, a guy from a premier school will not be fit for a startup is wrong because case study is one part. What is more important is the reasoning skill to work through hypothesis and work through the clutter to give shape to something. If that is not done, then how do you consider him to be a guy from a premier or an EB school? Our own hypothesis gets rejected there.
Right. Uh, so any advice, to so any changes that needs to be done in the curriculum of the B school, sir? Like anything that you would have observed, you would like to get it implemented?
See, basically, what is happening is uh, there has to be more affinity to the practical, to the way things are happening in the real world today. So, as you said, there was a point of time where B schools uh, focused a lot on the case study approach, which is fantastic because that's how we learn. Because now what I'm saying is B schools, many of them would be doing it for sure, and many of them are doing it. Get ingrained in the startup world, get ingrained in the small businesses. When I say small businesses, I am strictly going by startups because startups are the one that scale up fast despite
Mm,
all the bad name or good name they have
mm.
made for themselves. The way to business is grow fast, scale it in an ethical way, obviously.
Yes.
So if that is infused in the learning,
Mm.
then I think people will have find a blend of the academic rigor and the fundamentals and the practical nuances. Because any education without the academic rigor is a failure in my view.
Yes,
But
yes,
in any education that doesn't prepare these students for facing the real life challenges is also a failure. See, today what happens, I, as a management, strategy and consulting guy, rather a management consulting leader, when I put my hands on my first venture or first startup, in fact, which is still under, still there's work in progress. What actually was killing me was big thinking. I was thinking big, but not acting small. If you just think big and don't act small, you won't move forward. You'll be still, in a clutter of all that ideation stage.
hmm,
It doesn't help. Similarly, you take the path to investment. When I entered this world, I was a little confused and I was not able to draw the borderline between a VC and a private equity investment. But I learned it all along the way. When I made my investments also, I learned it through the process, where to make, what to do, where it could be a success, you
yes,
know kind of things which are not taught in B schools, and they cannot be taught in B schools.
right. So now, going back now, so going to your, venture capitalist journey and angel investor journey, we would like to understand what is our ventures, when do they invest, what is their portfolio like, and how do they operate?
Yeah, our ventures is typically both an angel platform which connects investors to startups, and also it has got a fund which is like about 15 to 20 million dollars to be precise. It's got its own fund as well as a platform. So our ventures typically, kind of it helps the startups raise funds both through the fund and through the angel platform itself. They have a portfolio of several companies, across sectors. I would say they're sector agnostic. A lot of things were going into the tech sector, but then since then they have made good exits and all that. But I would say the good thing about our ventures is probably, if I were, I don't have the statistics exactly at the tip of my fingers, but almost, I would say, 80% of their startups have given them decent returns where they've invested, which means they've
Yes.
made a very good job in picking and choosing the startups. So my role there is a venture partner. Venture partner is an external partner. And I'm also leading a couple of mandates in the healthcare industry, helping them, guiding them and helping them move forward along with fundraising.
Yes.
So there are similar several platforms such as our ventures existing in the market. Some of them have their own funds.
Got it, sir. No, we can't basically go ahead without one question being asked, is that since you have been in the healthcare industry for over a decade, what do you think are the major challenges which India faces in the healthcare industry, and what is the way forward to solve that?
See, India, what is happening is, before I, give any suggestions, there's been a lot of progress happening in Indian healthcare.
Hmm.
For example, the move from paper to computerized records that happened. Government has initiated the large Ayushman Bharat scheme. It has got a digital mission to digitize the entire ecosystem so that all of us are better prepared with our own healthcare records and all those things. And there's a huge focus that is coming up slowly, step by step, in the primary care. They're trying to open up the diagnostic, double down their efforts on the diagnostic centers, the primary care centers, and create, a better healthcare for all of us. But having said that, the major problems that still lie in healthcare is access to healthcare, affordability, and quality of reliability of care. Access, because see, in India, if you look at the number of doctors, beds, nurses, and all, the ratio of number of beds or number of doctors to the population is less than or in the vicinity of 1 is to 1,000 against the WHO standards of close to 3. So we are at a huge shortfall. So the objective is obviously to achieve more with less. The second thing is health insurance. As I say, government has this ambitious Ayushman Bharat scheme where I think 50% of the about 50 crores of the population will be covered. Uh, there is something similar to there for the white collar people, Arogya Sanjeevani, which if it comes will give healthcare to another several crores of the population. Then we have people who are in corporates; they are covered by the employer itself. Then some of the other states policies are there, the state ethics schemes as we call them.
Yes.
So if if all these things are integrated, there will be still about 30, 40 crores of the population who will have nothing. They don't have health insurance cover. So
Yes.
that's also a big gap in India. And today, if you see, most of the health insurance is for inpatient or hospitalization charges. There are a number of lucrative schemes on subscription model that have come up. Not that all of them are truly insurance, because the subscription and insurance are not necessarily the same things. But having said that, because of that thing which is lacking, healthcare is not affordable. Most of the more than 60% of the health cost for treatment is out of pocket, but that is getting reduced because of this Ayushman Bharat schemes coming into picture, innovative health insurance companies working on innovative things, and all those things that are happening. So access, affordability, and reliability of care remain as the key challenges, and that's because of the shortage in manpower, shortage in beds, and then the technology has to be pervasive. See, today with population, you want to use uh, a set of diagnostics for people in villages or screening of villagers. They have to either go to the hospital in the local nearby town, or there has to be a van or all that mobile vans and all that kind of things which go and attend to them. So a lot of developments are happening on that front. I am associated with a couple of firms for that matter, but there's still a long gap. There is a big gap and a long way to go. So that's what is the scene of scenario of healthcare today. But at the same time, you see some big advents happening. See, we had the indigenous vaccines, like that during the COVID, the vaccines got developed over a record period of time. Then I think India was the country which exported HCQs during COVID. A lot of trials happened. The only thing that is untapped is a large amount of data that already has been generated. Now that data has to be worked upon. Once that data is worked upon, what we call in medical terms or health terms as population health management will assume a big shape. When population health management comes into picture, you can segment the population, know doing what's happening to whom and what is happening and all. Insurance companies can do a better underwriting and come out with low cost health insurance products. So healthcare will be better for all. It requires a lot of work, both on the commercial side as well as the public health side. But having said that, healthcare is an area which has a lot of adjacencies. You make a small change in one, the ripple effect will be felt in another, many areas. For example, if you look at, monitor a patient and see what's happening, he's in the hospital, he moves out of the hospital, he goes home, whether he's responding to medication or not, you take that data. One is patients similar to him could be addressed much before then they go to hospital visit. Pharma companies can use that information to build products which will actually suit the patients. Today, out of
Yes.
100 patients, 30% people may not respond to that medication.
Genetic mark is something called na, sir, like making medicines as per the
Yeah, no, there is one is basically generic medicine, other is your basically specialty medicines. I'm
that is
saying,
the as per the genetic kind of makeup of that person, you make a medicine which
yeah,
actually.
that exactly, you're right. So sorry, I didn't get your point. Yeah, that is right. For example, there might be a person, like, for example, I'll give an example to your question. During COVID, there are many people who died because they had comorbidities. I hope you understand what
Yes.
comorbidity. They had comorbidities, they had other issues, or probably they had a severe infection. But there are other individuals who are very healthy. Neither
Yes.
they had comorbidities nor they had anything. There were people who were working out in the gyms. They used to take precautions, but still they
I am
faced.
one. I am one of them.
Yeah, one of them. So basically, what was done, what was did is for such kind of people, let's say out of 1,000, there are five people who are healthy but have succumbed, either been badly affected by COVID or succumbed to COVID and all. Is there any other genetic factor which basically impedes the action of the medicine? See, what were medicines doing during COVID? They were trying to throw a speed bump before the virus,
Yes.
nothing else. But some people used to, some healthy individuals used to be worse off. There could be a genetic issue with that. And that same genetic thing which causes your rare diseases also, all that, which is unsolvable. So that's another area that can be conquered with data. So what happens is when there is enough data to act on, you see a bigger set of population who might be have a chances of where the odds of contracting that disease or health condition will be there. If the number increases, then you can basically build more affordable health insurance products at scale. So the premiums will come down and all those kind of things will happen. So as I said, healthcare is such an area. You make a small impact change in one area, the impact is felt across the value chain, upstream and downstream.
Yes. Now, sir, you must have seen a lot of startups coming in the Ayurvedic space as well. Like,
Yes, yes.
startups like Nirog Street and all these. They are doing
Yeah.
pretty well. What do you think is the future of these startups? And because, since if you ask me, sir, I truly believe in in the ancient Indian, the knowledge base that we have, and a lot of things have actually worked out for me as well, like practicing yoga and practicing meditation and taking a lot of Ayurvedic medicines. What do you think is the future, and is it gonna be a problem solver for specifically from the primary and secondary health side, right?
Yeah, no, that's a good question. And as a matter of coincidence, I'm actually leading a mandate which is into this non traditional method of medicine. What the startup is trying to do is unlock the power of medicinal value from cannabis. So, cannabis, we all know, is a drug, but it has got huge medicinal value. Look at what's happening in the US. Many states have legalized marijuana. So, similarly, this startup is doing that. My only take is, if these Ayurvedic startups or Ayurvedic entities which are in the formative stages go on expanding their product line and sell everything under the roof, like you have see many things. Like you go to, I'll not name any store, but you go to the stores, you'll find a, a variety of things displayed under the shelves in the shelves. Well, that's not going to help. See, Ayurvedic is a thing which has taken a beating because of lack of empirical evidence or scientific evidence.
Right.
It's not that it's not there. There are certain things, like for example, if a plant has certain property, it will help you in this, but it has to be worked upon more. There has to be a lot of collaborations between academia and the startup that's doing that. In fact, the startup which I am handling is doing that. It's building its association with a lot of academia which are into research. There should be a lot of what I would say, association between the pharma companies and these companies, these Ayurvedic firms, so that trials, research, and all is done from the formative stages. So you don't need to be an Ayurvedic company which will sell, a lot of medicines under different names, Hasmola 1, 2, 3, not like that. We would like to see Ayurvedic companies which are actually getting into the realm of, let's say, uh, pain management. For example, terminal stages of cancer pain you know, is a horrible thing to bear. Or, for example, epilepsy. And the biggest part of the Ayurvedic medicines is they are not synthetic; they're natural. So, if you were to produce it naturally, if you were to get it proven and work in tandem with the institutions, organizations that I talked about, it's going to be a big, big breakthrough.
Yes.
Because alternate medicine is the need of the hour. It will also help you not just from consuming things which are natural, but also from what I would say the undesirable side effects and all those things. Today, you can't have you know, an antidepressant pill you take, or to take a pill to basically have a proper sleep in the night. Next, if you're feeling drowsy and if you're not productive, then you have seen with cough syrups. I'm just giving an example.
Yes. That
So,
is.
Ayurvedic medicine has got a huge potential. For example, this cannabis itself, which I'm talking about, globally, if you see, it has got a potential of, I think, roughly $150 billion as the addressable market size. Just to give
That
an example.
Yes, that is true, sir. And rather than taking antidepressant, I think if a person does yoga for like 15-20 minutes, he feels sleepy. He sleeps so well.
Yeah, so that's what I'm saying. So it is.
Great.
So, yeah, the Ayurvedic has got a huge potential to be a game changer, but if it's done in the right way.
Yes. Great, sir. Superb talking to you. Like, I have a lot of questions, but then we have a complete, kind of, we want this session to remain only for 40 minutes, so that
Okay.
we make sure that people actually watch it full, complete, and do understand the basics of healthcare, some of the topics that we discussed upon, touched upon. Plus we also went into understanding about how do B schools functions, what is their significance in today's world, and the significance of MBA education. Then we also learned about sir started with something, but then he was able to transition his career to something else. So it's always a possibility, till the time that as sir was talking about self belief, the value systems, and all those things which are so very important. So I again thank you, sir, for taking out time, and I hope this session will actually act as a guiding light for a lot of people, especially in the healthcare industry, and for everybody in the healthcare industry who is actually working on some problem, wants to get in touch. I will just post the
Yeah,
link.
sure, sure, absolutely.
Yes,
Because
and
healthcare has been my area of interest. One, as I said, I moved to that industry by chance, or maybe due to some linkages in the past, but then became a industry of choice for me.
yes,
I worked on it. Still, I have a passion, and anyone who's actually interested in doing something or already doing something and wants to see how to take it forward, I'm open to any conversations. So,
absolutely. And sir stays in JP Nagar, so I, I will also help you with his address if you're working on something related to healthcare.
sure.
And the best thing about Mr. Nanda is that he's always there to help you in whatever way possible. So great, sir. Thanks so much for talking to us. Thanks again for the time that you took out, and thanks again for the guidance that you actually provided to all of viewers.
No, my pleasure. And nice talking to you, Rishikesh. And I hope the audience at least benefited something from the discussions we had. Thank you.